KFL&A case update and explain to us what community spread means?
Yes, certainly. So with our case contact investigations, we look at the patterns and connection between cases. Some cases are grouped in larger settings where we call outbreaks, and there might be cases, might be linked households to a known outbreak taking place, and we certainly see a number of those in our region right now. But what's very worrisome, and that's what led to the conclusion that we are seeing community spread, is a nearly half of total cases are formed by smaller households, smaller clusters, where there might be individuals in a household getting sick, and there was never an established connection how the first infected person, where they got it in that household. So there's never not any evidence or not any known source how COVID-19 got to each of these individual clusters. And they are now nearly half of our total case count. They're distributed throughout the community. They're not linked to any of the known outbreaks. And because they are now almost nearly 50%, that's really what leads to the conclusion that we might be experiencing at this point community spread, and therefore there's need for additional precautions and additional measures put in place for individuals to be very vigilant and pursue testing when symptomatic. So the main important measure to keep in mind when we're in a community spread situation like this is for everyone in all the households, in all the groupings, for individuals to be very vigilant and mindful of their own symptoms, and do not interact with members outside of own household when symptomatic. That's something that we know from our case contact investigation, that's what's often leading to a number of exposures in workplaces, in social settings. Additional measures, as always, include making sure that individuals are immunized. As many individuals as possible, anyone eligible should take that opportunity and get vaccine, because we know that in households, even if there is a case, the immunized individuals are far less likely to be infected.